Welcome to Rototuna Physiotherapy Clinic. It's Jo McConnell here again. This time we're talking about your lumbar spine. So lots and lots of patients come into us complaining of low back pain. Do you know that 80% of us will have low back pain at some point during our life? So here's what to do. Here's how to have a healthy lumbar spine. So the first thing to recognise really is our lumbar spine is really complex. There's multiple joints, multiple nerves, soft tissues, and there's lots of different ways in which we can hurt our lumbar spine. And there's lots of structures that can give us pain, and often it's a combination of several of these structures that actually give us the pain. So good diagnosis with lumbar spines is really important. There's no one rule that fits everything. So the biggest thing to realise with our lumbar spines is that we live in a flexed world. So we drive sitting, we sit watching TV sitting, we often work at desks sitting, or we do manual labour type jobs where we end up sitting, we end up bending and rotating a lot. Our spine is a tall, you can see it there, a tall long column that doesn't really cope essentially very well with bending. It's a thin column, and if we spend all day in this position here, then we do run into trouble. So there's a couple of top tips for keeping your spine healthy. The first is to move. Make sure you're up and moving, doing some sort of exercise, 30 minutes every day, no excuses. The second is to maintain a healthy body weight. So it's pretty tough on your spine if you've got a big bare belly hanging out the front. The other final thing is to use your hips. So your hip joints sit down here, and when we move we have the option to either bend from your pelvis and use your hip joint, or you have the option to move from your spine. Far healthy for us to move from our hip joints, as they're a ball and socket joint. You have a huge degree of movement there compared to your spine that has 2 to 3 degrees of movement per level. Now the researchers have done lots and lots of work, particularly in Australia and Canada, on the best exercises for the spine. So often we'll toddle along to the gym and we'll do some sit-ups and some crunchies, and often that's quite good for physios because you end up seeing us. So the best thing for your spine is that we need to load it and strengthen it in a neutral position. So this is what we call neutral, and this is what we call flexed or bent forward. So we're already spending 80% of our day bent forward, so let's get some good strength happening in a nice neutral position. So the first thing I'm going to show you is some exercises from a Canadian physiotherapist who stuck electrodes into various people and looked at what gives us the greatest muscle strength but doesn't load the spine. So it's not going to make us worse, if that makes sense. So what we're going to show you is what we call a prone hold. So a really simple exercise where you keep your back into a neutral position. So you want to start on all fours on a firm surface. Come down to your elbows, make sure your elbows they come underneath your shoulders, and then feet shoulder width apart, and then keeping your bottom low, just lift up, almost like you're in a press-up position. Then you want to maintain that neutral position for as long as you can, and 45 seconds is a good start, and then anything longer than 2 minutes is probably enough. So from this position here you can easily turn it into a side hold, which will work your oblique muscles, so the other muscles that run down either side of your abdominal muscles. So just pop onto your side. Again, your elbow directly under your shoulder. To make it a little bit easier, you can put one foot in front of the other, both knees straight. Again, if you need to make it slightly easier, you can leave your left hand or your other hand, top hand, on the bed. And then all you're going to do is just lift your hips up so that you make a straight line. To make it more challenging, you can bring your arm up into the air or leave your arm on your side. You'll be able to hold that one for slightly less in terms of the time. And then you can switch over and do your opposite side. So a good 30 to 45 seconds is a reasonable period of time. So the next exercise we're going to do is looking at keeping your hips really strong. So if your hips aren't strong, your lumbar spine tends to be rotated, and that causes a bit of a shearing force through your lumbar spine. You end up really sore. So this is one particularly for the ladies. So you want to take your weight onto your right foot in this position here. Now what you're not allowed to do is what I call teapotting over, so you're not allowed to bend out to that right hand side. You've got to maintain your alignment as best you can, and you're going to pull out with your other leg. So it's just a little movement, and you'll start to feel it burning in the hip joint of the right leg, so the hip joint of the leg that's maintaining your balance.
And you should be able to whip out 3 lots of 10 to 15 pretty easily. If you struggle with this one, this is a good one where you can put something at a high surface beside you and just hold on until you get strong enough to actually do it. And then once you've done one leg, then swap over and do a set on the other leg.
Okay, so the final exercise we look at is a squat, and your technique with a squat is really important. So think of the Olympic lifters and how they do their squatting. So first things first, feet should be at least shoulder width apart, and if you have got tight hip joints you'll need to take them further apart. Have your feet in slightly external rotation, so they're pointing out slightly, and that makes it a bit easier on your hips. Now the key thing with your squat is to get your body moving backwards. So you almost want to fold in half through your tummy. So your arms come out, your bottom comes back, and then you lower down. And the key components are that your knees are never going over your toes, so this business isn't happening. So your bottom's going back, your knees are going back, and your arms are coming forward as a counterbalance. And if we said to you at any time through that movement to stop, you should be balanced forward and back, enabling you to stop. It's a really easy exercise to practice because you can do it every time you sit down. So every time you come to a chair, instead of plopping down in a chair like you normally would, you can plop down in your chair and have that nice spinal alignment. Really good for strengthening your quads, your glutes and your tummy muscles. When you go to come up, lean yourself forward and come up in the same manner. So it's all about using your hips and not your spine. So just to summarise on our top tips and things to encourage you to keep going with your spine. So the first thing is get out of flexion. So stand tall, stand as much as you can, use your hip joints, and the final thing is to get moving. So do some exercise, walking, biking, doesn't matter what it is as long as you're out there and you're moving. Thanks for joining us at Rototuna Physio Clinic. We trust that you've found what we've given you today helpful. Feel free to contact us, rototunaphysio@extra.co.nz.